If you're a man over 60, take a deep breath and stay with me because what I'm about to tell you could completely change the way you think about one of the most personal aspects of your health. But before we begin, make sure to subscribe to 60 Strength and Vitality for medically backed insights that truly matter. Leave a like if you care about your long-term vitality, and share this video with someone who deserves to age with strength and dignity. Now let's get into it. We're going to talk about something that is rarely discussed openly, daily M4sturb, and its real impact on prostate health after 60. There is no shame in asking questions about this topic. In fact, avoiding the conversation could put your well-being at risk. Let's be clear from the start, this is not about guilt, and it's certainly not about judgment. It's about science. Many men in their 60s and beyond are wondering if this common practice could be affecting their prostate, energy levels, or even their hormonal balance. So let's separate myth from fact, and give you real answers that are safe, professional, and rooted in trusted medical knowledge. First, let's understand what the prostate actually is. It's a small gland located below the bladder, surrounding the urethra, and plays a crucial role in male reproductive function. As men age, this gland becomes more vulnerable to inflammation, enlargement, or even more serious complications. And yes, your personal habits, including frequency of release, can play a role in that. So is daily M4sturb dangerous, or could it actually be beneficial? The answer is not black and white. In the next segments, we're going to explore the scientific evidence behind both sides. You may be surprised by what modern studies are revealing. Let's move forward with the facts. To truly understand how daily M4sturb may affect your prostate, we have to look at what happens inside the body during and after release. The prostate is responsible for producing a portion of the seminal fluid. Every time a man ejaculates, this gland contracts to release that fluid through the urethra. This process is natural, and for many men, it's part of a healthy routine that continues well into later life. Now, let's look at one side of the scientific discussion. Some research suggests that regular release, whether through intimacy or solo stimulation, have protective effects on the prostate. In fact, a notable study published in the Journal of the American Medical Association (JAMA) found that men who ejaculate more frequently may have a lower risk of developing prostate cancer. The theory is that regular emptying of the gland helps to flush out potential toxins or buildup, reducing inflammation and stagnation. That sounds like good news, right? But before you assume that more is better, let's take a step back. The key word here is balance. While moderate and regular release may support prostate health, excessive frequency, especially when combined with poor sleep, high stress, or low nutrition, can lead to hormonal imbalances, fatigue, and even irritability. Daily M4sturb, for some men, might become a habit driven by boredom, anxiety, or compulsion, rather than true physical need. This is where many men over 60 find themselves caught. Their bodies are changing. Testosterone naturally declines, sleep becomes lighter, and recovery takes longer. In that state, habits that once felt harmless may begin to drain energy rather than restore it. In the next section, we'll explore the potential downsides of daily release when it's not paired with proper care for the body and mind. Understanding this balance is essential to reclaiming strength, not just physically, but mentally and emotionally too. Finding a healthy rhythm is not about restriction, it's about awareness and connection to your body's natural cycles. At age 60 and beyond, your system operates differently than it did in your younger years. Energy is more precious. Recovery takes longer. But with the right approach, you can actually feel more balanced and in control than ever before. So how often is healthy? The answer isn't the same for every man. For some, a few times a week may feel energizing and help release tension. For others, daily stimulation may start to feel draining, especially if combined with poor sleep or emotional stress. The key is listening to your body. After release, do you feel restored or depleted? Do you experience calm or fog and fatigue? These signs will help guide your ideal frequency. In clinical settings, I often suggest men track how they feel over a week. Create a journal, record your sleep quality, energy levels, mood, and how often you release. After 7 days, patterns often emerge. Many discover they feel best with 2 to 3 intentional sessions per week, supported by rest, movement, and a clean diet. The act itself should not be rushed or used to escape boredom or anxiety. Instead, treat it like any part of your health routine, with purpose and presence. This simple mental shift helps reconnect your nervous system and reduces compulsive patterns. Also important is timing. Evening release may help with sleep if you're tense, but doing it late at night, especially with screens, can interfere with melatonin and make it harder to rest deeply. Morning release may feel energizing, but for some, it triggers an afternoon crash. Find what works best for your lifestyle. In the next section, we'll explore prostate-friendly habits that support circulation, hormone balance, and recovery so you can enjoy this part of your life without worry or risk. Let's now explore the supportive habits that can protect your prostate and help your body recover well, regardless of how often you engage in intimate activity. Remember, the goal here is not to avoid natural orgasms, to create an internal environment where your body feels strong, responsive, and well-regulated. First and foremost, let's talk about hydration. The prostate relies on good circulation and fluid movement through the urinary system. Dehydration can make urine more acidic, irritate the bladder, and contribute to inflammation in the surrounding tissues. Aim for at least 6 to 8 cups of water per day, more if you live in a hot climate or consume caffeine, which can be dehydrating. Second, we need to address diet. A prostate-supportive diet includes foods rich in antioxidants, zinc, and anti-inflammatory compounds. Think tomatoes, leafy greens, berries, pumpkin seeds, and salmon. These help reduce oxidative stress and promote better tissue repair. Avoid excess sugar, fried foods, and processed meats, as they may contribute to chronic inflammation, which is harmful to the prostate over time. Next is movement. Daily walks, light stretching, and pelvic floor exercises help reduce pressure on the prostate, increase blood flow to the pelvic region, and enhance overall recovery. Even 15-20 minutes of low-impact movement can have a significant effect on circulation and hormonal regulation. Also, make sleep a non-negotiable part of your recovery. Testosterone production occurs mainly at night. If you're only getting 4 to 5 hours of poor quality sleep, your hormonal system can't repair itself. Create a sleep-friendly routine, dim the lights, avoid screens late at night, and keep your bedroom cool and quiet. When you combine these habits with mindful control over your release frequency, you'll notice improved energy, clearer focus, and better mood overall. And now, let's answer the big question many men still have: is daily M4sturb dangerous, or can it still be part of a healthy lifestyle? So, let's answer the question many men have been asking: is daily M4sturb dangerous after 60? The honest answer is not necessarily, but it depends entirely on the context. If your body feels strong, your sleep is solid, your energy returns quickly, and your emotional state is balanced, then daily release may not pose a problem. In fact, for some men, it helps reduce stress, supports relaxation, and even improves mood when practiced mindfully. However, if you find that your daily habit leaves you feeling depleted, foggy, unmotivated, or emotionally flat, then your body may be signaling that it needs more rest and recovery. At this stage in life, your nervous system, hormone production, and prostate health are more sensitive to overstimulation. What was once automatic in your younger years now requires a more intentional approach. The key is how you feel after, not just during. If release becomes compulsive, disconnected, or driven by habit rather than true desire, it's time to reflect. Ask yourself, am I using this to cope with stress or boredom? Do I feel stronger after a weaker? Am I sleeping well? These questions reveal the deeper relationship between your habits and your health. It's also important to note that quality matters more than quantity. A healthy intimate life, solo or with a partner, is about connection to yourself, your body, and your energy. Fast, mindless habits, especially those combined with excessive screen use, can overstimulate your dopamine system and leave you more anxious or tired than before. So no, daily M4sturb is not inherently harmful. But done without awareness and without support from proper lifestyle habits, it can become imbalanced. In the next section, we'll share practical tips to create a balanced approach so you can enjoy this part of life without guilt, fear, or fatigue. It's time to move forward with confidence and clarity. Now let's create a balanced and sustainable approach to intimate health after 61 that supports your prostate, protects your energy, and respects your changing body. It starts with a simple shift in mindset, moving from habit to intention. Instead of following the same routine day after day, pause and check in with your body. Ask yourself, am I truly in the mood, or just reacting to stress or boredom? Begin by spacing out your sessions. If you're used to daily release, try switching to every other day for 1 week and monitor how your body responds. You may find improved sleep, sharper focus, and more stable mood. This isn't about denial, it's about optimization. Creating more space often increases the quality of your experiences. Consider pairing release with moments of calm, rather than overstimulation. Dim the lights, breathe deeply, and approach the experience as part of your wellness, not a distraction. This reduces nervous system overload and keeps your dopamine receptors from becoming desensitized. Next, practice physical care. After any release, hydrate well and stretch gently. Pelvic floor relaxation and light hip movements can help reset the muscles around the prostate and prevent tightness or discomfort. A warm shower or magnesium lotion may also ease tension and promote circulation. Don't overlook emotional health either. Intimacy is not only physical, it's psychological. If your habits are connected to loneliness, stress, or guilt, consider journaling or speaking to a counselor. There's strength in honesty, and many men find great relief simply by giving themselves permission to explore these topics without shame. Remember, you're not trying to be perfect, you're aiming for alignment. A strong man is not the one who suppresses his desires. It's the one who understands them, respects his limits, and makes choices that support long-term vitality. In the next block, we'll share signs your current habits may be harming your energy or prostate health and what to do if they are. Let's now look at the warning signs that your current routine might be placing too much strain on your prostate, hormones, or nervous system. These signs don't always show up immediately, but when they do, it's your body's way of saying, I need something different. One of the first indicators is persistent fatigue, especially when it follows release. If you notice that after M4sturb you feel drained, mentally foggy, or emotionally flat, this could be a sign that your system is not recovering properly. That doesn't mean you need to stop altogether, it simply means you may need more time between sessions or better support through sleep, diet, and hydration. Another sign is pelvic discomfort such as pressure, burning, or frequent urges to urinate without infection. These symptoms may indicate inflammation or irritation of the prostate, especially if you're not moving your body regularly or staying hydrated. In these cases, taking a few days off can bring noticeable relief. Mood swings, irritability, and lack of motivation may also appear in men who overstimulate their dopamine system without balance. If you notice that everyday pleasures feel dull or that you need more stimulation just to feel normal, your brain may be telling you it's time to reset. Also pay attention to sleep disturbances, especially if your release happens at night while using screens. The combination of artificial light and overstimulation can suppress melatonin and reduce sleep quality. If you find it harder to fall or stay asleep after nightly sessions, try shifting your routine or reducing screen exposure beforehand. The good news, your body is always willing to heal. Many men notice a remarkable difference within just a few days of changing their habits: more energy, clearer thinking, better focus, and even stronger confidence. In the final block, I'll share a powerful reminder I give all my patients who ask me about this topic and how you can use this knowledge to feel stronger, not weaker as you age. Here's what I tell every patient who comes to me with questions about this topic. You don't need to give anything up, you just need to understand how to give your body what it truly needs. After 60, your health depends less on what you remove and more on what you reinforce: rest, rhythm, nutrition, and self-awareness. Daily M4sturb isn't bad. What matters is whether it fits your energy, your recovery, and your lifestyle. When you approach it with intention and pair it with healthy habits like hydration, prostate-friendly foods, and proper sleep, it can remain part of your life without guilt, fatigue, or fear. But when it becomes automatic, disconnected, or excessive, that's when issues begin to appear. The truth is, you're not the same man you were at 30. But that's not a weakness, it's wisdom. Now, you have the ability to choose better, act smarter, and support your body with more awareness than ever before. That's what real strength looks like after 60, not just muscles or hormones, but understanding, balance, and self-respect. If this video helped you reflect on your habits or taught you something new about your health, I invite you to subscribe to this channel. 60 Strength and Vitality. Here we don't judge, we educate, empower, and support men who want to age with dignity and direction. You'll find weekly videos on topics like circulation, hormone balance, nutrition, mindset, and prostate care, delivered with clarity and care. Thank you for watching, and remember, your vitality is not behind you, it's ahead of you. Every choice you make now builds the foundation for the man you will be tomorrow. Choose wisely, rest deeply, and stay strong.